You know, it's one of those sounds that just stops you in your tracks. That retching sound that tells you your dog is about to be sick. And your mind just starts racing with questions and a whole lot of worry.
You're probably thinking, why is this happening? What do I do? And is this an emergency? Well, in this explainer, we're going to cut through the confusion and get you some clear, straightforward answers.
All right, let's get right into it. The first step in figuring this all out is to really understand what's physically happening when your dog vomits.
So, vomiting isn't just something that happens passively. It's a really active, forceful event. You'll actually see their little tummy muscles contract and heave. And there are usually some warning signs. They might start drooling a lot, licking their lips over and over, or pacing around looking uncomfortable. That's nausea setting in.
Now, this is super important, and it's one of the first things your vet is going to ask. Is your dog vomiting or regurgitating? They sound similar, but they're totally different. Vomiting, like we said, is active and forceful. Regurgitation, on the other hand, is passive. The food just kind of comes back up. No effort, no warning. It usually looks like undigested food, sometimes even in the shape of a tube. Knowing the difference is a massive clue for us vets.
Okay, so we know what it is. Now let's tackle the big question. Why is it happening? Well, there are a whole bunch of reasons, and they really run the gamut from pretty simple fixes to things that are a lot more serious.
A lot of the time, it's something simple related to their diet. Maybe they got into the garbage or you switched their food too fast. We call that dietary indiscretion. But we also have to think about more serious stuff, like if they chewed on a toxic plant, picked up an infection, or swallowed something they shouldn't have, like a sock. Sometimes, vomiting can even be a sign of a bigger, systemic illness affecting their organs.
But before your mind goes to the worst-case scenario, let's talk about something incredibly common that we see all the time: bilious vomiting syndrome. This is the classic, my dog woke me up at 3 a.m. throwing up yellow foam. Sound familiar?
This is the perfect way to think about it. Their stomach has been empty all night, but it's still producing acid and bile to get ready for breakfast. With nothing in there to digest, that bile just sits and irritates the stomach lining until, well, the body decides it's gotta go. The stomach is literally hangry. A small snack right before bed can often solve this completely.
Okay, so a single vomit might not be a huge deal. But how do you know when it's time to stop watching and start calling the vet? Let's go over the signs that should definitely get your attention.
This is it, right? This is the most important question on your mind, and the answer is all about being a good observer and knowing what to look for.
All right, this list right here is your guide. If you see anything on it, it's time to call the vet. No hesitation. A couple of these are critical emergencies. If your dog is trying to vomit but nothing's coming up and their belly looks swollen, that could be bloat and it is life-threatening. Any blood in the vomit is a red flag. And see that praying position where their front end is down and their butt is in the air? That's a classic sign of really bad abdominal pain. Always trust your gut. If your dog seems really sick, they probably are.
The color can also give you some clues. Like we talked about, yellow or green is usually just bile on an empty stomach. White foam often just points to irritation. But brown that looks like coffee grounds or any obvious red color, that points to bleeding and means you need to get to the vet right away. Making that decision to call the vet is absolutely the right move when you're worried. So let's quickly walk through what you can expect just so the whole process feels a little less scary.
It all starts with you. Your story is the most important piece of the puzzle. What have you seen? Has anything changed? Any missing toys? After that, your vet will do a complete physical exam from nose to tail. If we still need more info, we might suggest some tests, like blood work or an x-ray, to see what's going on inside.
So, after the exam and tests, what's next? Let's talk about the path to recovery. The great news is there's usually a very clear plan to get your furry friend feeling much, much better.
Treatment is all about supportive care. Basically, helping the body heal itself. We'll often start with anti-nausea meds to stop the vomiting and fluids to fix any dehydration. Then, we give that poor, overworked tummy a rest by holding off on food for a little while. After that, we slowly bring back a simple, bland diet. Think boiled chicken and rice. And of course, while we're doing all that, we're also treating whatever the underlying cause was in the first place.
And honestly, here's the best part. Dogs are incredibly resilient. The vast majority of them, even the ones who get pretty sick, bounce back completely with the right medical care and a little extra love from you.
So if you take away just one thing today, let it be this. A single, one-and-done vomit in a dog that's otherwise happy and acting normal is usually not a big deal. But if it keeps happening, Or if you see any of those red flag warning signs we talked about, please trust your instincts. Making that call to your vet is always the right thing to do. Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.